Whenever we recommend a knee replacement surgery to a patient, we give them an estimate of what is going to happen in the next 2 weeks to 3 weeks of time. We get a set of blood tests done, x-rays of the knee to check for the operability of the patient. We look for associated medical conditions which are likely to impact the results as well as the anesthesia. Normally, a patient is admitted a day before surgery. The pre-op workout is done. And when the anesthetist says that yes, this patient is a low surgical risk, then we go ahead and plan for the surgery. The surgery is usually done under a spinal anesthesia, which means an injection in the back and the legs will be numb during the procedure. A single knee replacement takes approximately 45 minutes to 1 hour of surgery. When we do both knee replacements in one sitting, it takes approximately 3 hours to 3.5 hours. The patients get a cut on the center of the knee in the front. After surgery, they get drains coming out of the knee which collect the blood, which is a waste blood. The patients are usually expected to stay in bed for the first 24 hours of surgery to minimize the complications because of anesthesia. Second day of surgery, they usually sit on the bedside and they start with the exercises. Most of the patients can stand on their own using a walker support either on the second day or the third day. This call is taken based on the pain perception of the patient and the associated medical conditions. Typically, we supervise physiotherapy very closely to achieve good results in terms of knee flexion and strengthening of the quadriceps muscle. The patients start walking with a walker support for first 2 weeks to 3 weeks, and they gradually shift over to the stick support at the end of 3 weeks. The sutures are removed at the end of 2 weeks or sometimes delayed depending on whether there is associated diabetes involved or any issues with the skin healing. Normally, a patient after a single knee replacement surgery would be able to become a community ambulator, means he should be able to go to the park and walk on his own using a stick support at the end of 3 weeks. In a both knee replacement patient, we expect this to happen at approximately 5 weeks or 6 weeks. Now, there are some myths associated with the knee replacement surgery. What we normally recommend is that such patients should not sit on the floor, squat, and kneel. The idea of advising this is because there is a metal component moving with a polyethylene. Whenever there is a hard component and a soft component, there will always be a wear component. To reduce this wear and to reduce eccentric wear, we advise patients not to sit on the floor after surgery. Most of the patients after surgery will be able to perform simple day-to-day activities up to the level of brisk walking, cycling, light sports, but they should not go ahead and plan for vigorous sport. They should not participate in vigorous sports or running events.